I had never been to Long Island before. Stepping into this hospital and just driving up, it's such a beautiful, beautiful campus. I really could see myself living here.
So I actually went to medical school here. I really felt like this was home. When I was interviewing and figuring out which residency might be the best fit, I felt exactly that same way like I felt during medical school, which is this place is my home.
I think that the camaraderie and the teamwork that we share here at Stony Brook is absolutely essential and vital, because you want to feel very comfortable and you want to feel very supported as you're going through 4 years of a rigorous process.
The postgraduate training at Stony Brook is really special. We are the only academic medical center in the region. We serve all of Suffolk County. It's a population of 1.4 million. Many of our faculty members have groundbreaking research in neuroimaging for psychotic disorders, mood disorders, substance use disorders, and our trainees are also involved in that research too.
The science in this department is stellar. I mean, the neuroimaging, a lot of the other translational work is really wonderful, and the residents have opportunities to get involved in that. It's a very robust program.
We feel very strongly if we're the only game in town, we need to be providing the best and newest treatments possible. We currently offer 2 residency training programs in psychiatry. We offer one at Stony Brook, which has a total of 30 psychiatry residents. And then we have a newer psychiatry residency, which is based out at Eastern Long Island Hospital, which has 5 residents per year.
So it's a really nice balance here at this residency program because you have the large research powerhouse academic hospital that is Stony Brook Main Hospital. And then here you have your smaller community hospital where everybody knows each other. It's nice to have that contrast.
At the Eastern Long Island Hospital site, we have all the full support of the main academic center at Stony Brook. Not only do they provide us with the cutting-edge research, but all our academics are shared now virtually between the 2 campuses. We're really here to provide training in community psychiatry, addiction psychiatry.
We get a lot of bread and butter depression, severe anxiety, particularly people with comorbid addiction issues. We do see some interesting things that are quite unusual that I don't think you would see at a regular community hospital.
The other purpose of this residency is to provide treatment to a group of patients that don't have access, and to hopefully have some graduates of the program stay on and work in this area.
It's really important to be able to absorb as much of information as you can when you're a trainee. And the advantage of being at Stony Brook is that you can learn from so many wonderful faculty. We have a broad array of specialties, and that makes it an extremely enriching environment for our residents to be part of.
The fellowships that we offer are in child and adolescent psychiatry, geriatric psychiatry, and consultation-liaison psychiatry. We also are going to be offering a new fellowship in addiction psychiatry.
We want fellows that share the same excitement that we do for these complex patients, that like working with physicians and nurses and social workers from other departments, that enjoy the complexities of a system of care that's large.
Stony Brook has Long Island's only CPEP, which is a comprehensive psychiatric emergency program. So we see patients from all over the county that are oftentimes brought in by either ambulance or police for emergency psychiatric evaluation. And our residents are the first line providers down in CPEP. It's really such a unique experience for them to see patients in their most acute states.
You really do get a breadth of a diverse patient population flowing through our CPEP, but then of course on our inpatient services, this is where you see your more chronic patients.
You really get to see how a multidisciplinary approach works with medicine, with psychiatry, and how much more efficient it is and how much better it is for the patient and patient care. And that's an experience that's very unique to here. Very few hospitals have that.
Not only do our residents and fellows have exposure to this highly complex case mix, but we have specific rotations that our fellows experience during the year.
So our trainees are able to rotate through the Northport VA, so work with a different system of care, the federal government system, and also work with the veteran population, which offers really unique exposure to different diagnoses, different treatment options. And Southampton Hospital and Eastern Long Island Hospital, which offer different experiences in addiction medicine and social medicine.
They are able to spend time at the Center of Excellence for Alzheimer's Disease, the Movement Disorder Center, as well as rotations such as the treatment refractory program, the use of TMS and ketamine.
Stony Brook Medicine and the Department of Psychiatry really embrace diversity. We think that people that come from different backgrounds, different training experiences really bring more breadth to our program and to our family.
Honestly, for me, being a minority, I did not feel left out at all. The program was very diverse. They have people from all different walks of life.
In my classmates, you can see, how many different medical schools we have come from, the type of cultural backgrounds that we have.
Having all those experiences come together was very unique, and we got to all learn from each other and apply that to our patients as well.
In the Geriatric Psychiatry division, our program provides residents with an experience in palliative care and an experience in a program for substance use disorders in the elderly population. We have research programs that look at late life depression research, neuroimaging research in cognitive disorders, depression, as well as some cutting edge clinical trials. We are able to make an impact in the lives of patients with dementia and Alzheimer's, as well as their caregivers all across Long Island.
Psychiatry, it is constantly evolving. There's always questions to be answered, there's always new discoveries, new treatments, and a lot of exciting things on the horizon for sure. And the nice thing about Stony Brook is that they are involved in that research.
We have a robust research department that's constantly developing, whether it's from a PET imaging standpoint or researching various biomarkers and looking at some of the underlying implications in chronic mental illnesses.
The Stony Brook PET Imaging Center is one of the most cutting-edge centers in the country. We have 3 amazing PET scan machines which are not easily available to a lot of other centers or other universities. And this allows us to study the brain in much more detail and a much more granular way to understand the inner workings that would be helpful to then translate into newer therapies and newer treatment modalities.
Medicine and psychiatry are becoming more and more integrated. Because of that, I feel like this program, especially the Consultation-Liaison Psychiatry Fellowship, is becoming way more integrated in medicine, and you really get that experience.
Stony Brook is a wonderful place to train in Consultation-Liaison Psychiatry because of the complexity of cases that we have here. Being the regional tertiary care referral center, our fellows have the opportunity to work directly with patients that are diverse from their backgrounds, but also have often highly unusual and very challenging conditions.
In addition to your medical service, you have all these specialty ICUs. You also have your OB cases, you have your neuropsych cases that you can see, which you won't really get in other places. You won't really see that diversity of patients and diversity of cases.
Our faculty are all passionate about not only patient care, but also education. They're intellectually curious, they have questions they want to answer through research, they love having trainees involved at all levels, and they also just really love having trainees involved on daily rounds, case conferences, didactics.
For our trainees, they have exposure to a tremendous range of experts in fields that allow us to broaden our thinking in terms of clinical care.
Having 70+ faculty, we pretty much have a faculty member that specializes in any area of psychiatry anyone could be interested in.
Stony Brook is a big institution with a lot of research and a lot of education, right? And it can be a big place. But the thing is that in this program, what I felt when I was interviewing was that it was an intimate family.
We're a really tight-knit group. There's definitely like that family feel. We just all support each other, we're all there for each other, and that's really nice to have.
So the biggest reason that I chose to come here for psychiatry was really because of the relationship between the attendings and the residents. You get so much one-on-one time with them, and they really teach you how to navigate through all the cases and be able to really have that experience with that patient.
We're here for them. From this first day they come into our program until the time they graduate, and even after they graduate, we're very much dedicated to their experience.
We have a faculty resident mentorship program where a faculty is paired with a resident from day 1, from July 1st, and they keep the same faculty mentor over 4 years. Every year the match is magical, and we wind up getting like-minded individuals that are really fun to work with.
I have seen attendings take that 5 minutes to really just get to know who are we. And because of that, then the education flows so much more easily. We're still learning, medical students are still learning, the attendings are also still learning, everyone is learning. And that's the beauty of it, that all of us have something to offer, all of us have something to learn, no matter what stage in our career we are.
They listen to the residents, they get the feedback, they make use of it, and they incorporate it into the program design. And in my experience, that's what makes this program different from the others.
The program is here for the trainees. If they have things that they think could be improved or things that they want added, we want to be able to do that for them.
I can't reiterate this enough, like how much support you really do get from the attendings here. They really do work with you, with your style, with your knowledge base, and they do keep track of you in didactics to make sure that you're presenting well, to make sure that you're learning what you need to be learning.
This type of program is good for someone that doesn't want to be lost in the crowd, wants to make those connections with the staff here. We really have a really nice team approach, which I appreciate because I feel like it results in better patient care.
There's nowhere else like Stony Brook. Not only are you going to be able to treat patients, see every type of patient you could possibly see, but you do so in such a supportive, nice environment.
I would choose Stony Brook again 100 times over because it just really allowed me to grow as a person and be able to really grow professionally in my career.